Packaged food makers and fast food chains could be forced to overhaul more of their products next year as a newly approved weight loss pill hits the market. That's according to food industry analysts who spoke to Reuters. The U.S. Food and Drug Administration approved Novo Nordisk's Wegovy GLP-1 pill on Monday, sending shares of food companies down on Tuesday. Eli Lilly's rival medication is expected to gain approval from regulators next year. Up until now, GLP-1 medications have only been available in injectable form. More Americans are expected to try the drugs as a pill rather than as a shot because the medication will be cheaper and many patients are hesitant to inject themselves. Food companies including ConAgra brands and Nestle are already dealing with shifts in consumer tastes toward higher protein and smaller portions due to the popularity of weight loss injections. Earlier this year, ConAgra started labeling some of its Healthy Choice frozen meals with high protein and fiber as, quote, GLP-1 friendly. Nestle, the world's biggest food company, has also introduced new frozen meals that cater specifically to GLP-1 users called Vital Pursuit. Some 40% of American adults are obese, U.S. government data shows, and around 12% of adults say they currently take GLP-1 drugs, according to a poll published last month by health policy research organization KFF.
The U.S. Food and Drug Administration approved Novo Nordisk's weight loss pill on Monday. The 25-milligram pill is made of semaglutide, the same active ingredient in injectable Wegovy and Ozempic. The pill will be sold under the brand name Wegovy. A 64-week late-stage study showed participants who took 25 milligrams of oral semaglutide once daily lost more body weight on average than those on a placebo. The pill was approved for chronic weight management in adults with obesity or overweight and at least one related health condition. This expands the patient pool at a time when obesity-related healthcare costs are climbing. It could help open a door to tens of millions of untapped patients in a global market forecast to be worth some $150 billion a year by the next decade. The approval could help spur a turnaround for Novo after a rocky year of sliding shares and profit warnings. Its injectable Wegovy faces slowing sales amid intense competition from Eli Lilly and pressure from compounded versions. Shares of Novo jumped 8% and Lilly fell 1% in extended trading after the approval announcement.
I'm thrilled to be joined by the leaders of 9 of the world's largest pharmaceutical manufacturers, all very big names, celebrities in their own right, very, very powerful people, and they head some of the most admired companies anywhere in the world. It's a great group. To announce that they've agreed to offer many of their flagship drugs, really all of their flagship drugs, at heavily discounted, most favored nations prices. In other words, whatever the drug sells for over the world, in the world, whatever the lowest number is, if it's Germany, if it's in UK, anywhere, we will match that price. Right now, sometimes it's 10 times higher. We've been laughed at and scoffed at for years. For years, the pharmaceutical companies were difficult, but they also love our country. They knew it was unfair. And they were great. I appreciate it. But the bigger problem was going to be the countries. How are you going to get the countries to do it? And we told them, if you don't do it, we're going to have to use tariffs, and we're going to charge you a 10% tariff, which is far more money than the money we're talking about. And they immediately agreed to do it. So we have all the foreign countries agreeing to do it. As of today, 14 out of the 17 largest pharmaceutical companies, but they've all agreed, have now agreed to drastically lower drug prices for their American patients, for the American people and patients. This represents the greatest victory for patient affordability in the history of American healthcare by far. It's an honor to do this. That's a good one. Today, I'm pleased to announce that I will be signing an executive order to reschedule marijuana from a Schedule 1 to a Schedule 3 controlled substance with legitimate medical uses. We have people begging for me to do this, people that are in great pain. For decades, this action has been requested by American patients suffering from extreme pain, incurable diseases, aggressive cancers, seizure disorders, neurological problems, and more, including numerous veterans with service-related injuries and older Americans who live with chronic medical problems that severely degrade their quality of life. I want to emphasize that the order I am about to sign is not the legalization, or it doesn't legalize marijuana in any way, shape, or form, and in no way sanctions its use as a recreational drug. It has nothing to do with that. That's a good one.
U.S. President Donald Trump signed an order on Thursday that recommends easing federal regulations on marijuana, kickstarting one of the most significant changes to the drugs policy in decades.
We have people begging for me to do this, people that are in great pain.
A senior administration official says Trump's order directs his attorney general to quickly move ahead with reclassifying marijuana as a less dangerous drug, putting it alongside common painkillers.
I don't want it, okay?
But Trump, a well-known abstainer of alcohol and drugs, says he doesn't want to use marijuana himself and emphasized a reclassification would not legalize it.
It doesn't legalize marijuana in any way, shape, or form, and in no way sanctions its use as a recreational drug. It has nothing to do with that.
Under the U.S. Controlled Substances Act, marijuana is listed as a Schedule 1 drug, like heroin and ecstasy, meaning it has no accepted medical use. In order to list it as a Schedule 3 drug, the Drug Enforcement Administration has to review the recommendation and will decide on the reclassification. Cannabis stocks jumped after initial reports that Trump may loosen restrictions. But Vanderbilt University law professor Robert Mikos says banks and investors would likely remain wary of cannabis companies, as a reclassification wouldn't resolve the conflict between state and federal law.
Until you make it truly lawful under federal law to make and sell this drug, banks are going to continue to be leery of dealing with companies in this industry. So this change by itself wouldn't remove that obstacle.
However, Paul Armentano, the deputy director of the National Organization for the Reform of Marijuana Laws, says the federal shift will create long-term change.
Over time, banks and credit unions and other financial institutions will become more comfortable with the fact that this industry is here, it's here to stay, and that clearly the federal government itself is also becoming more comfortable with this industry and more accepting of it.
Could smart flooring help reduce injuries from falls? Research